Thank you, Governor. And I appreciate being here with my colleagues and others who are here to help address what more we can do to stop the spread of COVID in South Carolina. Because this has been an extremely difficult year. So many illnesses, so many lives lost, and very unfortunately, we're not near the end of this. And in fact, over 239,000 probable or confirmed cases have been reported among South Carolinians, and 4,500 people have died from COVID in South Carolina. So with the recent news of the promise of the vaccine trials, this gives us great hope. But as the governor has commented on, it's going to be quite some time before we will realize the promise of having significant coverage for the majority of our population in South Carolina that would allow us to stop the prevention measures that we're recommending that are very effective. And our case numbers here in South Carolina have reached an unprecedented level, here in South Carolina as well as in the country as a whole. Our data points are worsening, unfortunately. So when we look back at just a little over a month ago, when 35 of our 46 counties were in a trajectory that for at least 1 to 6 days, they were in a downward trajectory. And now, just a little over a month later, only 6 of our South Carolina counties are in a downward trajectory. And just last week, we reported 2 of the highest days of cases since the pandemic first came to South Carolina. So with more than 13,900 South Carolinians last week alone being reported, that many cases in a single week, it makes this last week the worst it has been for us since the beginning of the pandemic. And nationally, the case counts are rising, hospitalizations, deaths, we're seeing this everywhere, and it's impacting our ability to share resources. It's impacting the ability for healthcare workers to travel from one jurisdiction to another to help, because we are all now pretty uniformly being affected across the country. And these sort of dire statistics are very personal to me, because every possibly preventable death that I hear about, every community member that is at fear of going to work or for fear of sending their children to school, when there is more that we can do to prevent this. And in fact, no one else should have to die from COVID-19, but unfortunately we will see more deaths. But the fact that it is within our power to control a great deal of this with the resources that we have at hand now is something that I implore all of you to pay more attention to. And there are recent projections from the Institute of Health Metrics and Evaluation that tell us what it might look like for us here in South Carolina if we continue to do what we're doing now. And that is by April of 2021, if things don't take a different course, we stand to see an estimated 1,000 deaths. So what that means is that from the end of November until the beginning of April, an additional 3,000 more South Carolinians may die if we don't do something differently. But the good news about this is that in these projections, they also say that if we were able to implement 95% use of masks within a week, that by that time in April, we could actually avert an additional 1,000 deaths. We could avert 1,000 more deaths. And in fact, if we were to do this 95% mask coverage within about 4 to 6 weeks, by the beginning of the next year, we would see a significant difference in our trajectory. So when we look back at what we looked like a month ago and where we look forward to what we could look like a month from now, there is significant control that we have over what we're seeing. And this public health is not about politics. The virus doesn't do its harm or doesn't spare people based on your political beliefs. We have to follow the scientific evidence in making decisions about what we're going to do. And so if we understand that this virus is spread by what comes out of your nose and your mouth, and that could possibly kill you, then if you cover your nose and your mouth, then you can save lives. And this is the level of control that we have over our trajectory in the near future. And the other measures along with mask wearing, the physical distancing. If we understand approximately how far the virus can spread and we stay that distance away from others, whether they are our family members who we're welcoming into our homes during the holidays or they're people that you don't know, then you reduce your chance of exposure. And while we're seeing approximately 20% of the people that we test are positive, that tells us that there's a great deal more disease in the community that is currently undiagnosed. So the more people that you gather around, the more you increase your chances of being exposed. So we absolutely need all South Carolinians now to do everything that they can to contribute to controlling the spread of COVID, to change our trajectory. Over the summer, we saw our cases surge after those holidays, and we can't continue to tolerate these surges and these downward trends. So if we take these measures, adopt these measures, and practice them consistently and routinely, we won't see these additional surges. We can get ahead of this pandemic while we wait for the promise of the vaccine. And it is true that we're very excited about the projected effectiveness of these vaccines, but the fact that they will be in limited supply for those who are, initially, for those who are at highest risk of being exposed and highest risk of suffering severe consequences, that it will be some time for significant coverage in the population as a whole. But that time will come. The plans to roll that out are somewhat complex. It involves the distribution plans, making sure that the vaccine is where it needs to be and that people who need the vaccine can get it. But we have in place, we are and can make those complex plans, but simultaneously we have to take the simple steps that are at our disposal. So while we can accomplish these plans, in the meantime, we have to use the measures that are at all of our disposal with the masks, the physical distancing. And I'm excited that we're working with many of our stakeholders to help us make these decisions in the state for the equitable distribution of the vaccine, to make sure that any barriers that may currently exist, particularly for those in rural areas who don't have adequate access to care, and where there aren't currently mechanisms in place for mass vaccination for those who may need it. We're working with our stakeholders to identify where those places need to be, and we're making plans to get the vaccine there. So I just want to end by saying that that I hope we can look back at this point in time right now as our watershed in this pandemic, that it was at this time that we made decisions that resulted in a change of our trajectory and that we did not go back up again. And that in the meantime, while we're waiting on the vaccine and we look forward to the time when there will be ample supply for everybody, there is a great deal more that we can do in the months to come to put us in the best position. So thank you.
Thank you.